In a little bit, you'll see Vilma and Alicia, they'll have these handouts for you. You can sign up. You just give us your name and your phone number. The first committee will be a committee that focuses on the model. What does the model look like? What are some of the things working in the country? Or do we have the premier model? What do we have to do? What is it? What are the aspects of a key model that results in a national recognitions for service excellence? So that's the first committee, simply called the Models Committee. But if you're a graphics person, a gestalt person, that's where you want to be. Now, if you're obsessive compulsive and granular and you want to look at data and so forth, then we got a committee for you. We have the second committee is what we call the Data and Analytics Committee. That committee will be looking at the key metrics, much like the Community Medical Directors has done for the last several years, at a community-wise in terms of what is it that you need to see. As an example, STRAC is looking at, STRAC is the Southwest Texas Advisory Committee. They're with
South Texas Regional
Southwest, thank you.
Advisory Committee.
What she said, Southwest Texas Advisory Committee. Lisa and Dr. Taylor have worked incredibly hard at this. When you see it, and we'll hopefully be allowed to give you a glimpse at it, it's tracking all of the emergency detentions across the county. That's the kind of information that we need to have available for you in many other ways. So the second committee is the data committee. The third committee is what I call the Connect the Dots committee. That's the flow committee. That's where do people go? What are the entities that are serving, and how do they connect, and how can they be leveraged? So we'll ask you to look into that and join us. And so I think that's it. Let me reintroduce Velma. She's going to get to the part where we all get to do announcements and so forth. So Velma.
Okay, real quickly, Alicia's passing out sign-up sheets for the three committees Gilbert just mentioned. These are just to note, these are just the initial start committees. I know there was committees in the previous consortium, so don't feel like this is it, there's no more committees. This is just something we wanted to start with. So they are being passed around, so please sign up for a committee. Again, there's the three. There's the flow, which is the mapping, connecting, bridging, then there's the data, and then the model. We want to be a national model. So that's one to do, is to please make sure you do sign up for a committee before you leave. The other one is, Gilbert mentioned earlier, it's called our little input sheet. We know not everybody got to speak today, but we do want to hear from you. Basically what this is just, what do you want to talk about? The item for consideration, the background, if you were from the previous consortium and you want to bring something forward and continue it on. And then your recommendation, and any other suggestions. If there's somebody that we're missing that should be here, I heard schools, that is important. We should probably get somebody from the schools here. If there's somebody, you know, an organization or group that we need to start inviting to this consortium, please put that on other suggestions. Anything that you have that you want us to know, or that you suggest, we would appreciate that. Now, announcements, a couple of things. We have a couple of great community events going on, and I'm going to, I want y'all to mark your date. First of all, before I say that, we will have the consortium meeting monthly, and our goal is to have it probably the last Friday of every month. I think Fridays work for judges, and we do want their input and invite them. The next consortium meeting is going to be July 25th, but that is going to be the subcommittees. Okay, so we're going to break that into a smaller group. It will be July 25th, Friday morning. We don't know the location yet. As soon as we confirm a location, you will be notified. Okay? The next big consortium, the whole group, is going to be August 29th. That's where the whole big group will reconvene. We'll talk about what the subcommittees talked about. So those are 2 dates I'd like for y'all to mark down. You will get notified. If you didn't, please make sure that you signed in before y'all leave. If your name wasn't on the list, we apologize, but just make sure that we have your name and your email so we can stay connected. So the community events, there's two great community events that are going to be happening both in August, and I'm going to let, y'all should have received flyers. I'm going to go ahead and let Liz from the Health Collaborative mention the first one, which is the community conversation, speakyourmindtexas.org.
So actually, I'd like Denise to stand. And so this is an invitation to all of you, and I'm going to actually pass this over to Denise so you should talk a little bit more about it. But there's a couple of members here that we'd like to recognize that are actually part of this committee that is making this effort available. So Dr. Jensen, Lisa, if you guys will stand. If you guys were part of this community conversation and bringing this to San Antonio and to Bexar County, if you guys will please stand as part of the committee. Thank you. Thank you. This is a free event that will be happening on August 13th, and it's really an opportunity for us to really start breaking down barriers from communication, not just from our providers, but also to our community. And I can absolutely appreciate what the Colonel said with regards to keeping everything very simple, very basic. We also have a San Antonio Health Literacy Initiative, and that's our focus, is to ensure that we're breaking down barriers from communication. Mental health has a lot of jargon. There's a lot of little things and acronyms that we use on a daily basis that mean absolutely everything to us, but for our community partner, for our patient, and for our family, it means nothing. It's just another barrier. And that immediately doesn't allow for them to be able to come to services where we can really help. So, Denise, if you'll business something.
Thank you. Liz really pretty much covered everything. I just wanted to have you take a look at the flyer. We're really partnering with some great people to put on this event. Though we invite all of you to attend, we're really trying to have this be a meeting of community as well. So as much as we want all of you to participate, we really want you to reach out to the community and bring new people in, families, consumers of mental health services. That's who needs to be present for this conversation. We're able to accommodate at least 200 people, and the Oblate has graciously provided us with the opportunity to expand beyond that number and to keep our costs down to be able to make this happen. We are, of course, looking for anyone who's willing to sponsor to help us underwrite the meal that we're going to be providing, because our goal is to bring out families and to provide them with a meal and child care and an activity for their children so that they can participate in these conversations. So that's always out there. We're always looking for ways to make that kind of thing happen. We really wanted to grab onto this. Clarity was really attempting to make this happen and link it up with their Clarity Con. It just couldn't work, and we just didn't want to see it fall through the cracks. So that's why we latched onto this and put a task force together, and that group has been phenomenal in moving the whole process forward. Partners like UIW and the Center for Healthcare Services have been fantastic in making this move forward as quickly as possible in a very small amount of time. And I just wanted to say that this really links to the Community Health Improvement Plan. One of the things that was identified was mental health, and that this was one of the top concerns in our community. And as part of that CHIP and Community Health Improvement Plan, we are dedicated to holding community-level conversations that tell us what we need to do. We've all said the same things over and over again, and we all know what needs to be done. We need to continue to get the involvement of community and move this train forward. I hope you all come.
Okay, and then one more great community event. John, if you want to talk about the consumer and family event?
Sure. Yes, and the next day, actually, after the meeting at Oblate, we're going to be having the 14th annual Bexar County Consumer and Family Support Conference. And this year we're expecting about 1,000 people there. So I already talked to Charlene about getting some of these books out to the families, and she's going to supply some of those. But also, at the first evening, I think, is a awards ceremony for people that have done great work in mental health in San Antonio and Bexar County. So if you have any nominations, Lupe Torres at the Center for Healthcare Services will take your nominations, and You know, we always honor people that are doing the work, the people from the media, and a number of different ways to acknowledge people that have done good work in mental health. So think about that and call her. I think she'll also take some prizes if you want to donate a prize for door prizes or whatever it is that she does there. And the committee's been working on this for a year, trying to come up with, I don't know, 4 or 5 or 6 different tracks for people to follow throughout the conference. And it's a 3-day conference on, you have your flyers, I think. It's on Thursday, Friday, and Saturday, I think. And it should be a great event and lots of folks there. So if we want to get, you know, education to the public, think about how you can participate in that, maybe this year or next year, to get some of that information out to the consumers that can make a difference then. Thank you.
And Donald?
Thank you, John.
I just want to leave you all with 2 last thoughts. Judge Spencer's NAMI presentation and warrants for your arrest.
Thank you, Judge. Gilbert?
Okay, so here are the next steps. We will begin to synthesize the information from the previous consortium, all of the input here, so please make sure if you have not had your voice on paper or being able to say, please get it going. We will put that all together. Then you will be hearing a series of communication from us so that we can begin to prioritize. We all know there are many wonderful things that we have to do, but the reality is that we will need to focus in on the top 3 or 4. So understand that. We look forward to seeing you. In summary, what we've done in terms of what I've heard today is we need to focus on gap analysis, alignment with the health collaboratives, definitely support NAMI, address children's services. The legislative issues were equity and getting behind